Welcome back to our Bluesy Water channel. Today I want to go over some protocols for working on the neck. I'm wearing a neck traction pillow here. We're going to demonstrate various therapies, which will include this neck traction pillow. So first I want to start off by just showing you the vibration machine. So we'll do that right now. Okay, so this machine is the same if you Google G-Force Pro or Vibratrim 500. This is the identical machine, just a little more affordable. And this is a dual motor vibration machine. By the way, this is the Hypervibe G10. It's another vibration machine. This is a single motor machine. I like the dual motor machines. This machine has a little more kick. It's a single motor, 8 mm amplitude, very powerful motor. It can go up to 25 hertz. And this motor, when you combine the two motors, you get a lot of possibilities. I like this for myofascial work. This G10 goes a little deeper into the bones. But you have more options with this one, and if you crank it up pretty high, you get pretty close to this one in terms of kick and power. So, you can contact us as far as vibration machines. We offer one for $450. It's a dual motor. The motors aren't quite as powerful and hefty, but it's still quite a machine. It's a new one. It has a 31-inch platform and a great entry-level vibration machine only for $450. It's very important that you get pretty stout motors, and that machine, the motors are quite strong. This machine is just sort of the cream of the crop. Okay, so we're going to show you some footage. I'm going to just get on here briefly and show you the how to use the traction pillow. Okay, so this is the traction pillow that's around my neck. You can get any of these on Amazon for around $15 to $20. There's two straps that Velcro on to secure it. I have this on. They all have a pump. This has a little slider to lock it in, and this one has a little ball in here. You can push it down and block the flow of air. If you just keep the valve closed, you really don't need the ball, but if you want to take this out, then you do need the ball. Okay, so basically I have this secure with the straps, and you're going to pump it up. Now if it's from completely deflated, it takes maybe 150 pumps, but this one's not fully deflated. So now you're going to start to feel it pulling on your neck. Now this is for anyone with nerve damage, anyone who's been diagnosed with disc issues, nerve damage. I would definitely consult your chiropractor or osteopath. I go to a chiropractor who's very cooperative, loves the fact that I do home therapy. We share information. If a chiropractor wants you coming back, they're going to tell you, don't do this. This chiropractor's like, oh man, that's great. If I had clients that would do home therapies, then they could get them out the door. So this chiropractor's desire is to see people go home, treat themselves, and not need him to resolve their issues, move on. This is obviously my goal as a practitioner. So you keep pumping until this is where it gets important that you don't especially at the beginning, do not overdo it. You'll feel, I'm getting to feel a pretty gentle stretch. Now I've done this a lot. So you could keep going. You could get a lot of what they call pounds of traction. In the literature, they talk about getting somewhere between 30 and 50 pounds of traction. Some people go way under. Start gentle. Do a few minutes. Once you feel a stretch, just hold it. We're going to turn on the vibration machine. Now I'm not going to crank it really high, but when you're on the vibration machine, we have another video showing this. You can gently wave wag your head back and forth. Pump it up a little more to where my comfort level is. But again, start slow, do a few minutes, don't overstretch. As you get used to it, you can go longer and increase the stretch. I had somebody, started in on this and they got all excited and overstretched. Your muscles will feel sore if you do that. So you have plenty of time to gradually work up the time. Once you get used to it, you can pretty much do it 2-3 times a day. But when you're on here, first of all, you're going to get a translation for the neck. Now there's also straps. There's arm straps on this that you can hold. Which will go deep, go right up your arms and into your neck. That's what's nice about this machine. The Hypervibe G10 does not have straps. I kind of rigged some straps onto my reflexology sandals so that I could actually get the effect of the machine from the feet, literally going up into the arms. But we have some, I think, a video showing that. But anyhow, there is a way to rig a strap set up if you attach it to some footwear, and then essentially you'll be getting the vibration off the platform up the arms. But anyhow, this machine has straps built into the platform itself. Some machines have straps which actually aren't on the vibrating platform but on the frame of the machine, so there's no vibration. So you're just kind of stretching your arms. Alrighty, so straps are nice. You're going to go right up the arms into the neck. If you have any radiating pain from a pinched nerve going and tingling in the arms coming from the neck down, this is going to work up that pathway. So these are the straps, you can do that. All right. Okay, so basically, I'm going to turn this off. So basically, gently traction the neck. Now, if you want to release it for a few minutes and just stand on the machine, that's fine. Now, of course, you can traction your neck without standing on a vibration machine. It's kind of a subtle movement, and so in general, using this vibration machine with various protocols, you can get way more release. This potentiates the movement of connective tissue. So we've shown many videos using this machine with a rapid release, and we're going to show you in the next segment here, just using a rapid release on the neck. So first step, you can traction without the machine. If you get the machine, stand on the machine, do the tractioning, build up slowly, use the straps to stimulate nerve pathways up the arm, back up into the neck. Okay, so once you're doing that, if you have the vibration machine, this is part of our vibration therapy program. We're going to show you the next segment. Okay, the next part is, this is a rapid release. I'm going to turn on and turn it off just to show you how this briefly works. I'm going to turn around and down the arm, and the limb. just wanted to show you briefly, so you could get a little feel live of what this is like. Essentially, you can track all around the neck, all the muscles. You can get into the scalenes. You can get into the clavicle region, and the bones themselves can lock and freeze. In cranial psychotherapy, it's about the bones literally not losing their rhythm and they freeze. This is a very unique therapy, but it basically represents holding a lot of tension in the body and not being able to allow a rhythm to be back in the body. Think of it as a tight drum head. You have a snare drum, you turn the screws super tight, and the head is like this. It's the best way to kind of give it a inroads into what craniosacral is. It's like tight drums. So the bones are very important. The connective tissue, everything that's coming off the neck down into the scalenes, even the occiput behind here. I don't want to get real technical, but essentially with this vibration machine and this tool, you can work the bones, tensioning of the bones, the connective tissue, all that fascia, it's called connective tissue, all the inserts and origins is a technical term, but essentially the pathways, and you can feel where it's locked up and not releasing. Now, in my body work, I would then use electroacupuncture and various other techniques where areas are very stubborn or release to get a release. Some of them are neuromuscular techniques, some are acupuncture, some of them are fascia techniques. This is where you can get the most bang for the buck as a layperson using these tools together. If you do this consistently, you can get into, even it might take some time, but areas that maybe I as a body worker could release more quickly because I understand how the region, what's causing that information to cause a lock, and I can work multidimensionally. Still, consistency on this practice, it might take a month or two, but you can get very stubborn areas to release, and you're doing a whole body therapy. So basically on the neck, after you do the tractioning, you want to work, as I briefly showed you, the neck muscles, front and back. Be very careful when you go in the front. You really have to get a feel for this. We can train you over the phone through a video conference, or at least give you a rough idea. Or if you had a cooperative practitioner, you brought this in, maybe they would help you learn how to use this tool, or find a chiropractor who does rapid release therapy, and say you want to learn a home self-treatment. If they're not willing to do that, then I'd say don't go to their chiropractor. This is the professional model. I would not buy their lesser model. It doesn't have the power. There are many tools on Amazon that have 3,500 and 3,400 max RPM. This is 10,000 RPM. It's just way deeper at breaking up fascia and scar tissue. However, anything's better than nothing, so if you can't afford this, it's expensive. If you can't afford this, you could try to get a less expensive, what they call massage gun. Bottom line is, after you do the tractioning, work the neck. If you have one of these, if you don't have a vibration machine, I would encourage everybody to try to buy the $450 machine. Then if you can't afford this gun, this is we can get you one for around $11.50, and buy one of those cheaper ones on Amazon, or even you can get them on Walmart. I mean, some of them are very cheap. And work your neck and your muscles with hopefully the combination of the vibration machine and the hand massage gun. Alrighty, so we obviously can train you if you come out to New Mexico. Once you actually feel the results of being treated with this therapy, you would become extremely optimistic at what is possible. Personally, even using this tool standalone without this vibration machine, I had certain tennis fascia issues that were very long standing that I could not release standalone with this tool, but ultimately was able to release with a combination of the two. Now, maybe on a client's I can do a lot of techniques where I probably could just with this tool release. If I had myself on a table, I probably could have succeeded, but literally I need me on the table and me treating myself. So for self-treatment, vibration machine and this tool, incredible combination, and that's how I resolve most of my issues. Alrighty, we're going to move on to using the traction pillow with a inversion table. Alrighty, thank you.
Here I am hanging on the inversion table. Now, this inversion table has different settings. You can go more like this or even less severe. Eventually I've worked to this position. You can actually completely hang, but I don't find that necessary. Once you're hanging on an inversion table, you can put your hands on the floor to actually break the tractioning. In other words, if you feel like you're overstretching, just put your hands down. You can squeeze your butt a little and push, and you'll actually release the tractioning. Then you can let go, and you can actually move back and forth. Let's say you have an area in your lower back. You can kind of squeeze your butt and focus on where the tension is. Push up and release. Alrighty, now if you have trouble with your neck, obviously hanging upside down, it brings blood flow to your neck. So you get a tractioning benefit just hanging. With the traction pillow now, I never, always start with it deflated. Do not put the straps on and get it ready, but you do not want to traction before you hang. Now you can start tractioning. So with the gravity pulling your head down and this, you can get some additional traction benefit. Again, you can move your head a little bit, back and forth, little light mobilization. Okay, that's as far as I'm going to go for now. Be very careful with your blood flow. And so normally you could do this and hold it for as long as, work up, and you can go 5, 10, 15 minutes, however long you want once you work up. I'm going to release this now. Alrighty, so anybody doing inversion therapy, go very slowly as far as building up the angle of inversion. You don't want to pass out inverting. Get used to it. You can get dizzy, nauseous if you're not used to it. So as with every other therapy, break it very slowly, start at a very slight angle. And then I would add this in only once you feel very, very comfortable with the inversion therapy. And then you might get some additional benefit for the neck. Alrighty, as far as inversion tables go, the Teeter is a very popular brand. I got this at Big 5, a very hefty inversion table, but very heavy. The Teeters are lighter. So you can just Google inversion tables, and depending on your price point, you might find one at Costco, sporting goods stores, online. Just make sure you get one that obviously is very safe, and you can Google and read all about inversion therapy. Alrighty, so again, just real quick, you can put your hand on the floor to break the traction and kind of squeeze your butt and do a little more of a flexation release technique. Then once you're very comfortable with therapy, you can get on your traction pillow and start pumping it up gently and build up gradual additional neck traction. Alrighty? And now I'm going to go back up. Thank you. Oops. Watch out for grabbing the clothing.
Alrighty, just to summarize, buy a traction pillow. You can get one on Amazon for $15. Read the reviews. There are many, many traction pillows. Start using it standalone. With every therapy, go slow, break in, don't overdo. Once you get used to the traction pillow, get on the vibration machine. If you have arm straps, use the arm straps. This will help with nerve pathways from the neck to down the arm to literally the tip of the finger. So particularly if you have radiating pain going down the arm, great to use the arm straps. Alrighty, and by the way, when you use an arm strap, you can do kind of rotations and, literally not just hold it in one place, but rotate your arm. That helps. Alrighty, another thing you can do, by the way, is squeeze tennis balls while you're on the vibration machine. This will send signals up the arm to the neck. Alrighty, So squeeze, release, squeeze, release. All right, we can help you with any of these therapies. Contact me, Andrew at bluesywater.com. Next, once you're done with the tractioning, use this tool while on the vibration machine to treat all around the neck. I would be happy if you got trained. Be careful. This always comes with a big asterisk that you need to be trained and need to be careful anytime you're working the neck. If you can find a local practitioner that uses rapid release therapy and is willing to train you, that would be the way to go. It's very important to find practitioners that support your home practice. It becomes very obvious quickly when you talk to them. Alrighty, so use the rapid release tool, not on just on your neck. We have many videos describing the combo therapy of vibration machine rapid release, all the incredible things you can do with that. So now the last step is get on an inversion table. Again, you're going to have to break in, gradually increase the angle, really get comfortable with inversion therapy. Once you have achieved full inversion, now for me, again, I don't go completely upside down, I go almost upside down, but I can get my hands on the floor. We discussed what you can do once you get your hands on the floor to kind of pump and release the spine. Once you're real comfortable with that, you can add in this as additional traction force. So hanging alone will create traction. This will increase the traction force and potentially allow a more deeper tractioning benefit. Be very careful. Obviously, as we showed, start with this completely disengaged, and then once you're comfortable, you're hanging, you're used to it, you can slowly and carefully add this additional traction, pump it up. Be very careful about circulation at all times. If you feel any beginning of dizziness or anything, then immediately release the traction on this or come up on the inversion table. Be very, when you do inversion therapy, it's very important to obviously be able to come up quickly and make sure your table is balanced. Alrighty, so these are all the different therapies. We'd be happy to assist you in a program. Always consult with a practitioner as to the condition of your neck to have it assessed and to have their approval on doing these therapies. Again, find a supportive practitioner that will be excited that you're willing to treat yourself. So working with that practitioner, you can really get great benefit. Once again, Andrew at bluesywater.com will post links below. Thank you. Take care.